If your knees ache when you get up from a chair, your fingers feel stiff first thing in the morning, or your hips complain louder than they used to on a walk, you've probably already tried the obvious things. Maybe some stretching, maybe an anti-inflammatory cream, maybe just accepting it as part of getting older. But there's a piece of this puzzle that gets far less attention than it should: nutrient levels. Specifically, there are 3 vitamins that show up again and again in the research on joint pain and stiffness in people over 60, and a shortfall in any one of them can make your joints feel worse than they need to. Today I want to walk through what the actual research says about each of these 3 vitamins, why deficiency becomes more common after 60, and what a sensible next step looks like, including where supplements are genuinely not the answer and something else needs attention instead. If you find this kind of research breakdown useful, consider subscribing, because we go through topics like this every week specifically for people over 60. Why joints change with age in the first place? Before getting into the vitamins, it helps to understand what's actually happening in an aging joint. Cartilage, the smooth cushioning tissue at the ends of your bones, naturally thins and loses some of its water content over decades of use. The fluid that lubricates your joints changes in composition. Low-grade inflammation, sometimes called inflammaging, tends to rise gradually throughout the body as we get older, even without a diagnosed condition like arthritis. All of this can add up to more stiffness, more ache, and less flexibility than you had at 40. Nutrient status doesn't cause all of this on its own, but it plays a real, measurable role in how your body manages inflammation, repairs joint tissue, and maintains bone density around the joint. And this is exactly where these 3 vitamins come in. Vitamin 1, vitamin D. Vitamin D is probably the most researched of the 3 when it comes to joint health, and the connection is fairly direct. Vitamin D plays a central role in calcium regulation and bone health, but it also has a documented role in modulating inflammation throughout the body, including inflammation in and around joint tissue. Multiple observational studies have found that people with lower vitamin D levels report higher rates of joint pain and stiffness, and some research has specifically linked low vitamin D to increased symptom severity in osteoarthritis, the most common form of joint degeneration in older adults. Here's why deficiency is so common after 60. Specifically, your skin's ability to produce vitamin D from sunlight declines significantly with age. Some research suggests older skin produces roughly half to a quarter of the vitamin D that younger skin does from the same sun exposure. On top of that, many older adults spend less time outdoors, and kidney function, which is needed to convert vitamin D into its active form, also gradually declines with age. National Health Survey data has consistently found that a large share of older adults, especially in northern climates or during winter months, fall short of recommended vitamin D levels. The research on supplementation is genuinely mixed rather than a slam dunk. Some trials show meaningful improvement in joint pain and stiffness when a real deficiency is corrected, while others, particularly in people who weren't deficient to begin with, show little to no additional benefit. The honest takeaway is this: vitamin D supplementation helps most reliably when you're actually low, which is why testing matters more here than guessing. Vitamin 2, vitamin C. Vitamin C's role in joint health surprises a lot of people, because most of us associate it with immune function and colds, not joints. But vitamin C is essential for collagen synthesis, and collagen is the primary structural protein in cartilage, tendons, and the connective tissue that holds your joints together. Without adequate vitamin C, your body's ability to repair and maintain that connective tissue is compromised. Research has found associations between lower vitamin C intake and increased risk of cartilage loss and joint degeneration over time, and some studies looking specifically at knee osteoarthritis have found that people with higher vitamin C intake had a slower rate of cartilage loss on imaging compared to those with lower intake. Vitamin C deficiency severe enough to cause obvious symptoms is less common than vitamin D deficiency, but insufficient levels, not full deficiency, just lower than ideal, are more common than most people realize, particularly in older adults who eat less fresh fruit and vegetables than they used to, whether due to appetite changes, dental issues affecting what they can comfortably chew, or reduced cooking for one. Vitamin C is also water-soluble, meaning your body doesn't store it well, so it needs to be replenished through diet regularly, rather than built up as a reserve. Vitamin 3, vitamin K2. This is the one most people have genuinely never heard of, and it's a bit different from the other two because its connection to joints is more indirect. But it's an important piece of the picture, particularly around joint calcification and bone cartilage interaction. Vitamin K2 activates specific proteins in the body that help direct calcium to where it belongs, your bones, and away from where it doesn't belong, including soft tissue and cartilage. When K2 status is low, some research suggests calcium can deposit inappropriately in joint cartilage and surrounding soft tissue, which may contribute to stiffness and reduce joint flexibility over time. Some observational research has also linked adequate vitamin K status to slower progression of osteoarthritis in the knee specifically. Vitamin K2 deficiency is harder to measure directly than vitamin D or C, and the research base, while promising, is smaller and less conclusive than for the other two vitamins on this list. It's a reasonable piece of the picture, but I want to be honest that the evidence here is earlier stage compared to vitamin D and C. What actually causes deficiency in these three, and why it compounds after 60 trutanes? There's a pattern across all three. Reduced sun exposure and skin changes affect vitamin D. Changes in diet and appetite affect vitamin C, and for vitamin K2 specifically, most people simply don't eat much of the foods that contain meaningful amounts of it. Fermented foods and certain animal products are the primary dietary sources, and they're not a large part of the typical Western diet at any age. On top of the deficiency risk itself, a few other age-related factors make things worse. Reduced absorption efficiency in the gut as we age, certain medications that can interfere with nutrient absorption, for instance, some cholesterol medications can reduce vitamin K absorption, and long-term use of certain acid-reducing medications has been linked to reduced vitamin absorption more broadly, and simply eating less overall due to appetite changes, which reduces intake of all three nutrients at once. What a sensible next step actually looks like. I want to be clear that none of these three vitamins are a guaranteed cure for joint pain, and I'd rather give you an honest, useful process than an oversimplified answer. First, get actual levels checked rather than guessing. Vitamin D is a standard, inexpensive blood test that most doctors can order easily. Vitamin C and K2 status are checked less routinely, but you can specifically ask your doctor whether it's worth testing given your symptoms, especially if your diet is limited in fresh produce or you're on medications that could affect absorption. Second, prioritize food sources where you can. Vitamin C is abundant in citrus fruit, bell peppers, strawberries, and broccoli. Vitamin K2 specifically, not K1, which is different and found in leafy greens, is found in fermented foods like natto, as well as in egg yolks and certain cheeses, though in smaller amounts. Vitamin D is harder to get meaningfully from food alone. Fatty fish and fortified dairy contain some, but most people who are deficient need either safe, moderate sun exposure, or a supplement to close the gap. Third, if supplementation makes sense for you, dosing should really be based on your actual test results and your doctor's guidance, rather than a generic number from a video. Vitamin D in particular can reach unsafe levels if oversupplemented over time, since it's fat-soluble and stored in the body, unlike vitamin C, which is water-soluble and harder to overdose on through diet or typical supplement doses. Fourth, give it real time and track your symptoms. If a genuine deficiency is corrected, most research suggests measurable improvement in inflammation markers within weeks, but noticeable improvement in day-to-day joint comfort can take longer, often 8 to 12 weeks of consistent correction, because cartilage and connective tissue repair slowly. When it's not a vitamin issue at all, this part matters just as much as everything above. If your joint pain is accompanied by significant swelling, redness, warmth around the joint, or pain that wakes you up at night regardless of position, that's a pattern more consistent with an inflammatory or autoimmune joint condition, like rheumatoid arthritis, rather than a simple degenerative or nutrient-related issue, and it needs a doctor's evaluation rather than a supplement trial. Similarly, if pain is isolated to one joint and came on suddenly, that's worth getting checked directly rather than assuming it's age-related wear. A quick safety note: if you take blood thinners, particularly warfarin, vitamin K2 supplementation needs to be discussed with your doctor first, since vitamin K directly affects how that medication works, and inconsistent intake can throw off your levels. If you have a history of kidney stones, high-dose vitamin C supplementation should also be discussed with your doctor, as very high doses have been linked to increased stone risk in some people. And as mentioned, vitamin D supplementation should be guided by an actual blood test rather than guesswork, since too much over time can cause its own problems. The bottom line, joint pain and stiffness after 60 usually isn't caused by one single thing, but vitamin D, vitamin C, and vitamin K2 each have a genuine, research-supported connection to how your joints feel and function, through inflammation regulation, collagen repair, and calcium management, respectively. The most useful first step isn't buying a supplement, it's getting your actual levels checked, so you know whether you're addressing a real gap or not. If this was useful, let me know in the comments which of these three you're going to look into first, and subscribe for more research breakdowns like this one.